Welcome to The Whole Story. I'm Anderson Cooper. In less than 10 years, 1/4 of the U.S. population will be over the age of 65. That means more people requiring more frequent and advanced medical care, which often means more pills. But there's a growing movement in the medical and scientific community that's urging less pills and more plants. They look at marijuana as a potential life changer for those suffering from age-related conditions like chronic pain, insomnia, anxiety, even Alzheimer's disease. But does cannabis really work for seniors? And is it safe? Over the next hour, CNN's Dr. Sanjay Gupta takes us around the world as he speaks to skeptics and advocates who are studying cannabis. Sanjay also meets with older users who say their quality of life has improved because of marijuana.
Almost exactly 10 years ago to the day, I've returned to what many call the holy land of medical marijuana, Israel. And it was here about a decade ago outside of Tel Aviv, I met a group of seniors who were using cannabis to treat everything from their pain to their post-traumatic stress to their tremors, even their anxiety. 10 years later, the work and the tedious gathering of data continues. These are the growing fields of Tikun Olam, which translated means to repair the world.
It's different than what you saw 10 years ago when you were here?
Yes, very different.
Yeah.
Lihi Bar-Lev-Shuleiter is the director of research here.
This will be...
She's also one of the reasons Israel has been such a world leader in medicinal marijuana.
For us back then, it was everything we wanted to achieve, but that study led us to different understanding of the treatment in the elderly.
The final research results were published in 2020, and they found a sharp improvement in the patient's medical conditions and a decrease in prescription drug usage. Once again, more plants, less pharma.
When I saw that cannabinoids are approved for epilepsy for children, I thought if they can help here, they might help in the behavioral disturbances of dementia.
It was a simple theory. During a seizure, the brain has these sudden outbursts of electrical energy, kind of like what you see here, and that can lead to physical outbursts. Hermouche thought the same thing might be happening in dementia patients, leading to behavioral outbursts.
Avidekel was tested in so many clinical trials.
So, with the help of Lihi Bar-Lev-Shuleiter, they put it to the test. 60 patients, average age 79. Half got Tikun Olam's cannabis oil, which is 30% CBD and 1% THC. The other half got a placebo, and no one knew who got which. After 16 weeks, there were no serious side effects in either group. But the cannabis group had significantly reduced agitation. They also found something that surprised them. In some of the cases, patients were also able to reduce the other drugs they had been taking. Again and again, it was more plants, fewer pills.